is defined as an abnormally and persistent elevated mood, expansive mood, and irritable mood. So when a patient, we were fortunate enough, our
To see it,
group,
yeah.
to be with someone who demonstrated very many signs and symptoms of mania, including pressured speech, speaking very rapidly. So elevated mood is defined as euphoria, very, or elated, very high. Now, we all feel that way sometimes, like when you pass your test, you'll feel very euphoric and elevated. But the difference with mania is it's consistent and it keeps going higher and higher. Now, bipolar, think of it as two poles, North Pole and South Pole, high and low. Now, with the high, can a body maintain that heightened euphoria indefinitely? No. So with mania, you have to have, there's two types, there's bipolar 1 and bipolar 2. And we'll get into the different types. I don't think I say which one is bipolar 1, which is bipolar 2, but we'll get into the differences. So mania consists of elevated mood, euphoria or elation. Expansive mood is lack of restraint in expression and overvalued self-importance. I am the smartest person in the room. That's what the manic person will be saying. I'm the best to handle the finances in the family. I am the smartest, I'm the best. Very expansive and irritable. They become very easily annoyed and provoked to anger, particularly when their wishes are challenged. So let's say a person is experiencing bipolar mania and they're out on the street, or they walk into this classroom and they start saying how smart they are and how wonderful they are and they're the best. If anyone questions them, they can become very agitated, aggressive, and that's when the fisticuffs. This is a person that is not usually like this. When you see a person experiencing bipolar mania or depression, it's not them. It's not that person. People with bipolar need to be on medication their entire life. They need to be on mood regulating medications, and that's why I had you do Neuro 1 and Neuro 2. We'll get into them. So a manic episode is for a distinct period of time. The human body cannot stay manic for days on end. So it may only be maybe 3 days, and then they'll go right into the depression. Their body will just collapse physically. Mood lability is rapid shifts in mood with little or no change in external events. And what does that mean? Nothing is going on differently that causes them to shift their mood.
So there's no trigger?
No triggers, or no change. Like there's a conversation going on, and all of a sudden, they'll have a rapid shift. So mania or hypomania alternating with depression. So I'll talk about those two. So bipolar 1 consists of major depression, manic or mixed episode. So classic manic depressive disorder with mood swings alternating from depression to mania. With mania, it is a distinct period of at least 1 week or less, because the body can't go on indefinitely in a manic state. It's just not physiologically able to.
This is the people that will pace back and forward, they won't sleep, they won't
Pace
eat.
back and forward, their hands might
Right.
be clenched, they're very grandiose, I'm the smartest, I'm the best, abnormally and persistent, nonstop, elevated, expansive, or irritable mood with abnormally increased goal-directed behavior or energy. This is a person who is experiencing this that may get in a car, empty their bank account, drive to Atlantic City, and spend every ounce of money. You wanna share something?
Yeah, I have a friend who, when he goes to Mania, he just does crazy stuff like that.
That they never do before.
He never would do that. He'll go and empty his bank account and go.
Fly to
visit Atlanta.
Vegas.
Yeah, he's done that, yeah, you gotta watch him.
Be with prostitutes, sexual promiscuity, use of drugs excessively, use of alcohol excessively. This is the hallmarks of mania. You could deplete finances. How do you think a person who is in a manic state, let's say you're in a home with children, what do you think the interaction is gonna be with your loved ones when you're manic? Who's gonna think of that? How are they going to act?
Very aggressive.
Very aggressive, and they might do what?
Hit
Hit
them.
them.
Hit them,
Yeah.
yell at them,
Rape.
physically. Also,
Do they? She brought up one point. Do they get to that point? Are they able to be somebody else to the point that they might rape somebody?
sure, it could be
They
doing
can?
anything. It could
Wow.
be, it's behavior that's not usually their behavior. And,
Oh.
okay, because of this, what kind of trouble are they gonna get into?
Jail time.
Legal, yes. Legal time, they might be driving around, somebody, they
Fighting.
cut them out, get out of the car with a baseball bat, and start smashing the windows. So, that's why I feel bad with people who have this disorder. It's to me very sad.
They're really not
They
them.
They should go to a psychiatric hospital. It's very sad to me, I feel like. But when you see them come into the hospital, it takes only a few days to get them back on track again.
Oh.
So I feel really bad. There was a situation a few years ago where I was in clinical with the students. It's not the clinical we're going to now. And the students were all whispering, and I said, let's go out. And I pulled them aside, and of course cameras, we all know the negative thing cameras can do, right? Apparently there was a person, an older person, very old, who had a manic episode. Somebody filmed it, and I guess, they all saw it somehow. And apparently this person went into a restaurant in Brooklyn, like overturned the tables, did a lot of destruction, and then went outside in traffic and actually took their clothes off and climbed on the roof on the windshield of a car. And it just so happens that this person was a patient and just totally different. And it was a good learning experience for the students because they could not believe after seeing that video that was the same person. And that's not unusual with mania, So with promiscuity and sexuality, what could they wind up with?
Sickness,
STDs,
disease for their whole
what else?
life.
Pregnancy.
Mm-hmm.
So they're all things that end assault. So when people have this disorder, it's a real disorder, like the patient who took all his clothes off at work. Just took everything off and shared with the students that my boss said that I could come back as long as I take my medications. With bipolar 1, you have that mania, you also have the depression. The depression is when you can't even get out of bed. So you have the high,
And the low.
That's bipolar 1. Got it? Bipolar 2, they have the major depression, and they don't have mania. They have something known as
Hypomania.
hypomania. And what hypomania is, it's not that manic. They're not very quickly walking around and they won't go out and do those things that I said, but how you'll know them is their speech. And they have that, did you ever hear the term, the person is a motor mouth? Motor mouth, they speak, see, that's why I have to clarify things. So that means someone, did you ever hear the term, you can't get a word in edgewise?
Mm-hmm.
Did you ever talk to someone and you can't even say anything yourself? And I'm not saying that this person, to use this as an example, has bipolar, I'm not saying that. But sometimes when a person has hypomania and you're having a conversation with them, they monopolize the conversation and you can't get one word in. Can you imagine? Well, if you can't, just think of it like that. No one can say anything. So they may not go out and spend all the money. So with this getting on a plane, spending your money, getting into a motor vehicle accident, is a high risk for what? Impulsivity, they're very impulsive. Suicide. So they may act in a manner that they would never have acted. They may
Then
just
you-
jump off.
And this is the hypomania?
No.
The other one. That's bipolar 1. Yeah.
Well, honestly, bipolar 2, if they're very depressed.
They could
do
suicide as
that
well.
too. So how is someone going to be as a patient with mania? Well, did I tell you the one, the patient jumped out and kicked the door? Did I tell you that one? Oh, so that's a mini one. So we had a patient, it was the first day, not with us.
But wait, I'm confused. The motor mouth is the hypomania? Okay.
So the patient was a really long hallway, not one of the hospitals we use, and he was escorted by security onto the unit, and he just bolted out of the wheelchair, ran down the whole floor and did like a karate kick, lifting his legs up, and just, it was a special glass that doesn't break, and it broke. And, you know, there's wiring underneath it. And he was just so agitated and aggressive. And so when they're on the unit walking, you'll never get them to sit in the dining room to eat. So with a patient that's manic, you want to give them finger food, things with protein, tuna sandwich, peanut butter sandwich. You don't want to give them a big like bottle or anything, they might throw it at you, but keep them hydrated, give them food on the go. They'll never sit for a group, and actually, you wouldn't be able to tolerate them in a group because they monopolize, and we might see that this week, maybe tomorrow. We'll see that if we get to hear Dr. Carr tomorrow, if he comes tomorrow, you might be able to witness a patient. And oftentimes, if you're in a therapy session, they're going to have to ask them to leave because no one is getting any treatment at all. Yes?
With bipolar 1, the person will sit. The bipolar 2 will sit down but won't allow you to get a word in.
No, neither one of them are going to be sitting down.
Oh, okay.
Probably. So, and don't make it more difficult than it is. It's
Got
easy.
it.
Don't be thinking of different.
Okay.
Just think of bipolar 1 high and low.
And low, okay.
And bipolar 2 has the hypomania, it just means the mouth. They're not gonna have that high mania.
Okay.
Cyclothymic disorder, which I don't even think I asked anything about that. Hypomania and depressive disorder, but does not meet the full criteria for major depressive disorder. You know how I passed around the DSM? And all the criteria in order to get the diagnosis? That's cyclothymic. It doesn't meet all the criteria. Okay, so with bipolar, you have a patient who is experiencing mania. What kind of activity are you going to do with them? So I can tell you for you many years ago where they had a beautiful art room. If it's too much, you can close it. If people are suffering, I don't want anyone to suffer.